Welcome to the Food Junkies Podcast. Here, we aim to bring you the experience, strength, and hope of professionals working on the front lines in the field of food addiction. Our mission is to educate you, the listener, and increase overall awareness about food addiction as a recognized disorder. Here, we discuss all things recovery, exploring the many pathways people take towards abstinence in order to achieve a health-forward lifestyle. We hope to inspire you to thrive rather than just survive. So stay positive, make a change for yourself, and share your journey with others. And hopefully the message will spread.
Processed food is a major contributor of irritable bowel syndrome and inflammatory bowel disease. What is the best way to manage these conditions, especially for the food addict? Welcome to the Food Junkies Podcast. My name is Dr. Vera Tarman, and I am your host today, interviewing Josh Dech, a holistic nutritionist with an expertise in inflammatory bowel disease and irritable bowel syndrome. He got his training in holistic nutrition from the Canadian School of Natural Nutrition in 2021. These innovative approaches have led to the successful reversal of over 300 cases of inflammatory bowel disease, and Josh now serves as a physician consultant at the Priority Health Academy, where he educates doctors on holistic approaches to gut health and IBD. He also hosts a podcast, ReversABLE, which shares insights on gut health and its profound impact on overall well-being. This podcast is the second of a two-part series. Last time we talked at great length about the conditions, irritable bowel syndrome and inflammatory bowel disease. Today we will focus on their treatment, especially as it relates to the food addict. So welcome back, Josh.
Pleasure to be here, Vera. Thanks so much for having me on twice.
Thank you. As a reminder, can you tell us briefly about your practice and your clinical work for people who may not have listened to the first one?
Absolutely. If you haven't listened to the first one, I absolutely recommend going back and doing that. We had a great conversation. But the long and short of it is I used to be a paramedic, and I fell out of love with the reactive medical health care and really wanted to focus on proactive. And so through a long series of events of watching what is practically miraculous things happen, from a woman who's 57 years old, taking 27 pills and 2 shots of insulin a day on disability, CPAP, the works, to having no medications and breaking world records at age 59. And so that was what I saw could be done. And I just absolutely fell in love with this process. And so here we are now, where I'm specializing in gut health and gut disease, which really is the anchor point or the hook for any and all health conditions under the sun. They're all connected in some way to the gut. And so here we are.
And what is it that you actually do? You have a 3-month program. What is your job here?
Sure. My job is made up, like all things are. So I am, by definition, a holistic nutritionist, and my job is to help people reverse their gut diseases. I specialize in Crohn's, colitis, and even severe IBS through a 16-week program. We've had people come through just recently. Larissa was a great story. Her bowels were so severe. I'm talking, she described it as having squirrels with razor blades for hands running around her insides. The pain was immense. Our first phone call, when we actually met, she was on the toilet during that time. She's no control, chronic pain, bleeding, and the doctors actually wanted to cut her bowel out. And so by the time she was done 16 weeks, she came back with a near perfect colonoscopy, and their jaws are on the floor saying, what's happened? And so we're very root cause focused towards reversal of what the Western world is calling irreversible gut diseases.
And you will give them a diet, but I think you do a certain amount of nutritional supplements from what I can gather.
Yeah, diet tends to be a small part. When we're dealing with gut issues, on the general, if you're part of the 70% of North Americans, 60 to 70, who have some kind of gut issue, we're talking about bloat, pain, constipation, diarrhea, a little bit of sensitivity. Oftentimes it's your diet that's causing the problem. But there are things that can be much more severe where diet, it's a contributing factor. And so if you've got, treat your body like a cup full of water. We all filled up a cup of water right to the brim where it's about to bubble over. For most of these people dealing with Crohn's and colitis, diet is the last drop that causes things to overflow. That pizza, that beer, that Mexican restaurant, whatever you went out for, that is the thing that caused your cup to overflow. Now you're in a flare, say. But your cup was always full. My job is to go through and figure out what filled the cup, why isn't it draining, and what else has gotten wet, so to speak? What parts of your organs and your systems, your liver, your lymphs, your kidneys, what else has gotten damaged residually through this? including a lot of the blood work that we have to look at otherwise. It is a very root cause approach. It involves supplementation. We have people doing external stuff, such as acupuncture, red light therapy, exercise, sauna, sweating, some manual exercises. Even coffee enemas are oftentimes part of this protocol to release some of the toxicity from the body so it can begin healing itself.
It's not just focusing on what's going in, i.e. diet, but also how to get rid of some of those toxins.
We have to consider you get disease because things have come in. We're only ever sick for two reasons at the root core of it: toxicities or deficiencies. And so if you are deficient, your defenses are down and toxicities are more prone to come in. And we hear toxicities, we go, it must be heavy metals, it must be mold, it must be environmental or pesticides. Toxicities, we can also include parasites, fungus, mycotoxins like mold. There's all kinds of toxicities out there, but they create inflammatory responses in the body, drawing down our reserves of nutrients. So now we're both toxic and deficient, and we double down on disease. And this is where a lot of this comes from. And so our job is really to go in, remove the problem that is invaded the body, leading to these inflammatory responses, and repair and replenish what's missing, what's been damaged, and all the residual in between.
How would you do that? The person comes in like the person you just described. What would your approach be? How would you know where to start?
It's a great question. So let's talk about Larissa, because there's a recent video we just put up on YouTube, and she had 2013, she was diagnosed with ulcerative colitis, and it was really severe. Like I said, 15, 20 bowel movements a day on the toilet during the first call that we had together, because there was just so much urgency and pain and inflammation. And so we went through that process, and we had to sit down to go through our interview. Let's talk about how this all came to be. Normally, when you go to your doctor, what do? Tell me about your symptoms. That's all I need to know. You're 5 minutes, 7 minutes in and out, send you for some tests. What they're looking to do is effectively block you into what's called diagnostic criteria. Can we put you in a box? Once we have enough symptoms, check, we then give you this label, this disease diagnosis you have. Once that's there, we know what drugs to give you, in which order, 1, 2, 3, 4, 5. And if it doesn't work, snip out comes the bowel. But picture for a minute, Vera, you went to the doctor because you stepped on a nail, and that nail's stuck in your foot. And the doctor looks at you and goes, Vera, that nail looks really bad. It's pretty painful. Hey, you're like, yeah, it's really inflamed and it's getting infected, and I don't know what to do. Now imagine, Vera, your doctor leans in real close and says, unfortunately, that nail, nothing we can do. It's just part of your body now. It's part of your DNA. And here's what we can do. I'll give you some numbing cream. Use it for the rest of your life. And if it doesn't work, we'll cut your foot off.
Yeah, I was just waiting for the surgical option.
That's it. And that's what they do with bowel disease. They go, this is just part of your DNA. There's nothing we can do. Here's some immunosuppressives to manage your symptoms. If it doesn't work, we'll cut the organs out. That's how they treat disease. It's that absurd. But inflammation is always just your body reacting to something. So our job is to ask what that is. And so in Larissa's case, we had her come in. We took a look at her symptoms. We went back to 2013 when she was diagnosed. And then we went several years before this. How did it come on? Slow onset, rapid onset, overnight, couple of days, weeks, months? Any lifestyle interventions or changes? Any symptoms that you had developing prior to the diagnosis or the development of your gut disease? Skin issues, sleep issues, anything we can look at. Blood, hair, skin, nails. We look at libido. We look at SIBO conditions or other diagnoses of the gut that maybe progress towards. We've got 200 questions to go through. And so we went through this process with her to figure out her root cause. And it turns out she had a parasite condition. I'm talking like 3 and 4 foot worms coming out. We had pictures of these things. Her doctor's jaw was on the floor on the follow-up colonoscopy because it was near perfect. And he's like, what the hell happened? I've never seen this before. And we had to go through.
We did a colonoscopy because that's the kind of thing you would do with IBS or IBD because you want to see how inflamed it is. And they missed parasites?
Parasites are very hard to see. And this is something that I won't fault the doctors.
Parasite? Hold on.
I know. You think you're looking for an anaconda in the jungle. But here's what we have to know. Parasites are very difficult to see. They can hide in crypts and folds. Colonoscopies are going through the colon. Some go full length. Some don't go all the way through. Some only get so far in. And then, of course, you have your sigmoidoscopies will go in through the top, or endoscopies. They can get into different areas. But we have to consider is parasites will hide in the liver, the gallbladder and bile ducts. They'll hide around the appendix or the ileocecal valve, so where your small, large intestine can connect. They can hide in the crypts and folds of the bowel tissue as well. They can also, if they're small enough, they'll actually slice through the gut lining and get into your muscles. If you have chronic lower back pain, regardless of exercise, chiro, physio, you're just not getting better, on top of other gut issues, psoriasis, and different things that we can often see, eczema. These are typically connected to parasites. We've got clients coming in with hip pain because the parasites can get there as well. So they're not just isolated to the gut. And we do see a lot of these getting missed. You should see this stuff coming out of people's bowels. It looks like another episode of Alien vs. Predator, just colonoscopy episode. It's shocking, but they're in there.
How often do you see something like this? Is this like fringe that we're talking about, or is this actually much more common than we think?
80% of the clients we see have parasites of some kind that are visible. Yeah, I've had them. I actually took a video of my own. There were 12. I pulled, and I've still got them. I'm still working through them. But our ideology is this, and this will be pretty in line with, I say, most parasitology experts, is that if you're alive and have a pulse, you've got a parasite. If you have a gut issue, there's a chance that either they're the prime thing we need to remove right now, or they're going to be very close to the top 3 things we have to take care of for you. We see so many people, look, 70% of homes in the USA have a mold infection or a mold problem, and at least 44% of people are prone to having mold infections in the body, which can lead to all kinds of things from anxiety to depression to asthma to migraines, Parkinson's, or of course, bowel disease, and so much more. And so mold is a prime breeding ground for parasites. They love that area. It's inflamed, it's toxic, there's excess bacterial overgrowth and all kinds of opportunistic bad guys overgrowing inside of your gut that is prime real estate for parasites to come in. And so this is where we see a lot of activity of parasites and related to bowel disease. It's, like I said, about 80%, I'd say, the clients we have parasites as an ongoing active issue contributing to their problems. And so we have to get through there.
I can confirm for anybody listening that the traditional approach, parasites are not top on the list, not at all. The medications, if we're looking at prednisone or the anti-inflammatories, that doesn't touch them, does it?
Not really. You think about it, there's over 1 million different types of parasites that we understand there to be worldwide. About 1,400 can infect humans. And we see typically the same 1 to 2 dozens. If we're able to get them tested, we'll see the same 1 dozen or so on testing. On the other hand, parasites, they're extremely prolific. They're very good at hiding, very good at surviving and defending. And we hear all the time, I've taken a parasite protocol, or I took mebendazole or fenbendazole, and I didn't get any better, so it must not be parasites. Or I've had a parasite test and it came back negative. I must not have them. At best, parasite tests are going to be 40% accurate. Within about 30 minutes of being excreted, they can start assimilating their own DNA. They make enzymes that actually break themselves down. They hide and crypts and folds the works. And so they're very hard to actually get into a test unless you're so abundant they're falling out, or you're very lucky. And we typically find it's the former. They're just so abundant that you can't help but capture them.
Yeah.
But they're in there. And it's not as easy as just taking some protocol on Amazon and getting rid of them. There's a lot of work to do.
I'm remembering when I did family medicine, we used to order O&P, which was ova and parasites, and then we would just throw an antifungal at the person. It worked or it didn't work. That's a pretty haphazard approach. It sounds like you have something much more detailed.
Yeah. We have to think about this. If you're trying to remove something from the body, you're evicting tenants from the building, but the doors have to be unlocked. Many of us don't even have proper drainage, we call it. So drainage is your mobility, how things will move around the body and how things exit. So we understand drainage, sinuses, things drain out of there, bowels and urination. That's how things escape. We also have your skin, we have your liver, we have your bile ducts, which is a huge one. Even the lungs can be a drainage pathway, but liver and gallbladder and bile ducts are often extremely neglected. But they're some of the most important parts of digestion, assimilation of food, of elimination of waste and toxins. There's all kinds of enzymes that will actually bind and recirculate as well. Particularly, there's one we can see called beta-glucuronidase. This is produced inside the digestive tract, and this will actually recirculate with toxic bile. If you have poor drainage, your bile ducts are clogged up, your liver's toxic, and this might be somebody who has greasy stools, yellow or even gray or pale stools. It might be somebody with really smelly, like foul smelling stool. You're sensitive to fats, fatty foods, whether that's fried foods or a juicy fatty steak or olive oil on a salad dressing. Right? It could be any of these things you might be sensitive to. These are just some very simple examples. And if you're finding you're bloated, constipated, urgency, you have floaty stools, oily, greasy stools, anything like this, it can be a sign that your liver, gallbladder, bile ducts are going to be a bit junked up. And so if we're having this problem, we have to open those pathways first. Otherwise, the parasites will never get out. We do a minimum with clients we know have a confirmed parasite issue, minimum of 30 days of drainage before we go on a parasite protocol of any kind. And I've got 15 clients all running the same parasite products 25 different ways, because we have to apply it to each individual uniquely based on how their body's responding and what's going on inside. It's not quite as simple as I think a lot of us maybe think or hope it would be. Take this pill. And plus, think there's 1,400 different varieties of parasites that can infect humans. You're taking mebendazole or fenbendazole or whatever you're taking, fluconazole, some antifungal. How do I know it's going to do the job at all? Maybe you hit 2 species out of 1,200. Good luck, right?
Yeah.
Or 1,400. So we miss that.
It's a one-stop-fits-all with family medicine.
It's really unfortunate what happens there. Dr. Paul Merrick was telling me about a medication, mebendazole, like we talk about here. Very great for parasites, very commonly used. One of the issues they ran into, allegedly, there were some relatively high-level celebrities diagnosed with stage 4 cancer. And they went out and they took some mebendazole, 15 cents a pill. Stage 4 cancer was gone. And then suddenly Big Pharma increases the price from 15 cents to $555 per pill. That's like a 55,000% increase, which is crazy. If I went to the eye of a hurricane after a big storm, look what just happened recently in North Carolina. Imagine going down there and selling a bottle of water for $100 to somebody in a crisis. You go to jail. It's like war profiteering or something. But when pharma does it, it's totally allowed. It's absolutely crazy what happens with these medications.
How would you do the drainage? How would you drain before you start treating the parasites?
Such a great question. There's a combination of a lot of different things we have to do. So I don't want this to come across as medical advice to you listening right now, because if you drain too much too fast, you make yourself very sick. You can hospitalize. You have to be seen by a professional who specializes in this stuff. So please don't just take it randomly. But let's look at drainage. Really great things we can do. Number one, just hydrate. You got to make sure you have enough liquid. And so I'll have, for example, you might drink 500 to 700 mils of water first thing in the morning with electrolytes. Most of us have highly toxified water. Most water is very toxic, full of heavy metals and uranium and chemicals and all kinds. Best case scenario, let's just go gold standard. You drink some reverse osmosis water that's been remineralized. You add your own minerals back in with electrolytes first thing in the morning. Get yourself hydrated. And then there are actual products you can utilize that will support drainage, certain herbs. There's all kinds of blends and stuff we utilize. Big fans of companies like Cellcore myself. We use a lot of that for drainage. But this can look like getting out actively, just moving, sweating. It can be yoga. Sometimes we'll have people perform lymphatic drainage. There's a great video on YouTube called The Big Six. And they do this lymphatic drainage where you have a couple of points on the neck, the collarbones, pecs, belly, groin, behind the knees. You'll rub 10 times, pat 10 times, and this promotes lymphatic drainage. So we're just looking to move stuff. It's going to look like red light therapy, sweating, exercise. It's going to look like TUDCA, TUDCA. It's a great supplement that we often utilize to help thin out the bile, get rid of some toxins, and move some of that liver and bile congestion as well. We'll often use things like coffee enemas, which are extremely good for detoxing and drainage. And what a coffee enema will do, there's a lot of polyphenols and antioxidants and anti-inflammatory properties of the coffee, provided you let the coffee cool to 100 degrees before you put it in. Do not put hot coffee up your butt. But what it'll do is the caffeine acts like a static binder. It'll actually go in and grab onto some of these toxins and draw them out of the tissue.
I thought it was a stimulant.
Oh, it's a huge stimulant.
That as well. Okay.
Yeah, caffeine can be very stimulating. I read something years back. I forget exactly the mechanism, that caffeine itself is not stimulating. It actually inhibits something else in the brain that leads to stimulation. Yeah. But the caffeine can be very stimulating. But it does happen to bind onto toxins as well. Like taking a balloon and rubbing the carpet and touching your hair, right, where it pulls. It does this as a static cling and can pull toxins out of your system, in which you can, again, open up your drainage pathway. Think of it just like cleaning out the air vents, the air filter. There's not enough movement. All these things can help drain that toxicity or those toxins building up inside the body, particularly liver and bile.
They do say that coffee is a good for morning constitution. That's if you're drinking the coffee, but you can also use it as an enema itself.
Yeah. I do coffee enemas when I'm in a protocol for parasites. I do them relatively often. I'll do them 2-3 days a week during a protocol. And I think everyone should do a parasite protocol at least once a year. For our first time, it can be 4 and 6 months long for some people because they're so embedded. But it has to be very touch and go. You're on the gas, off the gas, based on how you feel. If you're nauseous, if you're tired, if you're fatigued, if you have joint pain, you're not sleeping, any symptoms coming up, we have to pull back on the gas because you can make yourself sick. But coffee enemas can be powerful. And there's typically 2 methods we'll use, for example. The first one is just a standard retention. So it'll be a 2-liter bag filled with your coffee. And oftentimes we'll add things like TUDCA or trace minerals or parasite products or something to the enema. And that'll be retained for 10 to 15 minutes. You empty the 2 liters into the bowel, hold for 10 to 15 minutes if you can, empty it out, and you're good to go. There's also what we call the break the dam method, where it'll be anywhere from 250 to probably 400 mils. You fill it up, empty it out, fill it up. You hold for 1 to 2 minutes, rather, empty, fill and hold, empty, 4 or 6 times. Now, the typical retention enema is really good for detoxing, specifically grabbing more toxins and pulling things out of the system. Whereas the break the dam method, your pulse on, pulse off, fill up, and empty, is typically good for even biofilm disruption. It can be a bit better for that. There's a lot of biofilms we'll often see in the bowel when it's inflamed, when there's parasites, mold, or any kind of toxin. So there's a lot of different methods we'll use for different reasons.
What do you think about it was maybe 10 years ago, the whole phenomena of going for a colonic? You go somewhere and they do the whole thing for you over the course of an hour.
Yeah, I think there's lots of benefits to that because you're going in hydrocolonic therapy. You are cleaning out the colon specifically. We've recommended it to clients, where we say, hey, go talk to a specialist because there's a lot of plaque buildup. There's a lot of junk and mucus that can build up and you're just giving it a good clean. Now, do we want to rely on them? No. If you have to continually go for a colonic, you got another problem. Nobody in the history of the world since the last, 40 years since they've been a thing has ever needed to go for a colonic. But the reason we do this hydrocolonic therapy, or this hosing, basically flushing of the bowel, is because there's so much toxicity or buildup or other junk in our system based on the way our body is becoming toxic in the world we live in today, which is not compatible with our biology. No animal in the wild living in its natural habitat needs a hydrocolonic therapy. We shouldn't either. It's just because we're so hypertoxic. And I say this just to contextualize and say, look, if we're continually going in for a colonic to manage your bowel, you have another problem. You have to stop whatever's causing the problem so you don't have to continually clean it up. It's like you got water in the floor in your house every morning. You can mop it up, do your colonic therapy, but what's causing the leak? You have to get there first.
And it surely can't get those parasites that are hiding away somewhere.
Sometimes it can be helpful, but parasites, keep in mind, they can hide anywhere. You're absolutely right. You're going to miss a lot of them. But we have seen some parasites come through hydrocolonic hoses because they'll often have a clear tube where you can see it all coming out. Yeah. And so we look at parasites, for example, like I said, they'll hide in the crypts and folds. This can help. If they're bound into plaques or hiding through biofilms, this can sometimes help. Otherwise, parasites, if they're up in the liver, bile ducts, appendix, if they're in the small intestine, you're not going to get them out. Parasites will eat all kinds of stuff for food. They'll eat iron. If you're chronically anemic, it could be parasites. They'll eat lymphatic fluid. If you're getting mumps and lymphatic issues or like mastitis, like breast inflammation, there's a lot of lymphatic tissue. It could be parasites.
With diabetes, the person's foot gets really weeping and swollen. Could that be a parasite issue?
I can't actually say for sure, Vera. It's not something I have direct knowledge or experience on, but I could hypothesize. If you have parasites blocking up lymphatic, yes. But think about someone with diabetes. When their blood sugar levels are so elevated, you're going to have very viscous, very thick blood. Well, your bloodstream and your lymphatics, they work together to move fluid and toxins and all kinds of stuff, nutrients, or your immune system moves around through that lymphatic system. And so if you're having a lot of backup, it could be just the viscosity of the blood leading to inflammation. And now you have so much extra toxicity and inflammation going through the system that it's not actually draining through the lymphatics properly. It's like you're trying to vacuum something up, but the hose is too small. And so it creates a blockage. And that's maybe my theory as to what's happening there with the edema, or we see in the swelling of the feet as well through diabetes. If we look at drainage number one, so we have the doors are unlocked. Now it's time to evict the tenants. Yeah. If you have some kind of, let's go back to parasites, or maybe it's fungal overgrowth or something that's contributing to your issues, any bacterial overgrowth, you now have to get them removed. Sometimes you have to break down biofilms first. With parasites, we typically will get some of them before we do biofilm, but you can get in there and start removing a bunch of junk and moving these invaders from the body that are causing your problem. And they're quite infectious. Right? Think about this. If you fall and scrape your knee on the pavement, you get a little rock or a pebble stuck inside that wound, you don't remove it. Imagine how inflamed that would be from a tiny little pebble. Now picture you have a 4-foot worm, the thickness of your pinky, hiding inside your body. How inflamed you're going to be comparably. Of course, you got bowel disease. So they can take a bit to remove, but now we go to the removal process. So drainage support number 1, removal number 2, whatever that looks like, whether it's a fungus, whether it's a mold toxicity, whether it's parasites or Clostridium or E. coli or cytomegalovirus or Epstein-Barr, whatever it is you're trying to remove, we have to begin the removal process.
I would think medications.
You're bang on. So whether it's over-the-counter supplementation, whether it's medication, we are advocates for integrative, which means we're using over-the-counter supplementation to help kill off some of these things we're trying to get rid of, but we can also support them with pharmaceuticals. I'm not anti-pharmaceutical. I think people see me as a holistic practitioner and make the assumption that I'm anti-pharmaceutical. But the truth is I'm not. I'm anti-reliance on pharmaceuticals to manage symptoms. But Western medicine and these pharmaceutical drugs, they're great at 2 things. Number 1 is emergencies. Number 2 is surgeries, which means they're really good at short-term acute things. If I'm going to take a medication for a short-term acute problem, bang on. However, if I'm going to take it for a long-term chronic inflammatory condition, you sure as hell bet you're going to be on them for life, you're going to be dependent, and they're going to create side effects leading to more medication. There's a reason why North America, let's say USA, spends the most money in the world per capita, so per person, on healthcare. The 3 biggest industries are health insurance, hospital care, and pharmaceutical drugs, making up 18% of the entire country's GDP, $4.7 trillion a year revenue for the United States of America through sickness. 60% of adults have some kind of chronic inflammatory condition. I believe it's 66% of adults are on 1 or 2 prescription drugs.
So many people are on the PPIs, like for GERD.
Huge part of the problem. Think about what stomach acid does. Stomach acid is a regulator. It's a digester. It allows you to actually break down, absorb, and assimilate nutrients like iron, for example. It's hard to pull things out without acid. And so you're supposed to break it down. But I have never, Vera, in my entire practice, ever seen a single individual who's had too much stomach acid. It's actually too low. What happens is the sphincters above and below, so the entry and exit of your stomach, are pH and pressure sensitive. So you need the fluid volume and you need the acidity of the stomach acid in order to keep those open and closed. And so if you have too low, it's not getting the signal to say close up. So you bend over, lay down, and up comes the acid. And we take antacids, which suppress the acid further, contributing to the problem. And now you got Barrett's esophagus, you have some kind of issue. And now you're not killing off microbes that enter your stomach. You're not breaking down, digesting, and absorbing your food. You're going to become nutrient deficient. What were the 2 things that we said were the leading causes of disease? Toxicities and deficiencies. If you do not have enough stomach acid, you will inherently be deficient in nutrients, leading to disease. On top of that, you're not going to regulate the microbes coming into your body that you're ingesting or whatever you're taking in, which means you're also going to have overgrowth that leads to toxicity. So now you have deficiency and toxicity simply from taking a PPI for acid reflux. And we wonder why 60% of all American adults have a chronic inflammatory disease.
And that's not even got to do with the foods that they're eating. That's just compounding the problem. The fact that they're taking meds because of the food.
You're bang on. It's a compounding issue. And oftentimes, I think we often look for the silver bullet. Like, what is the thing that I'm doing wrong? What's the thing I can do better? And the truth is, I think you said it really well. It's a compounding issue. One thing leads to another. So you're high stressed, you're eating poorly, and you're not sleeping very well. Okay, so now you develop acid reflux. So you take the PPI and you suppress the acid even further. So now you're deficient in nutrients and you have bacterial overgrowth. Now that bacteria and those overgrowths lead to more bloating, discomfort. So what do? You go back to the pharmacy and you take another medication of some kind.
You up your dose of your Losec or your
dose.
Pantoloc to double the amount. Is that why taking vinegar is actually good for GERD or reflux?
Yeah. Apple cider vinegar, it's 1 of 2 things. I'll either use HCl, so hydrochloric acid pills you can use, or you can use apple cider vinegar, which I use as a temporary, not long-term measure. But my wife, when she get really stressed out or be going through something with work, she'd get a little acid reflux, little shot of apple cider vinegar, of course, diluted in water because you'll burn your esophagus, but it would go away magically. Bing, bang, boom, done. But that's what it is. It's closing those valves up. But some people who've had this for a very long time, it's not as simple as just taking the stomach acid now or replacing the acid, because your lining in your stomach, it's very much a don't use it, you lose it situation, right? If you're not utilizing it, think of it like wearing a sock inside of a shoe. Your sock is there to protect your heel from the damage of the shoe. Well, when you're ingesting food, in order to protect your stomach from the physical abrasion of that food coming in, you have this mucosal layer. It acts like a sock. But if you don't use it, low stomach acid, you lose it. And so you start adding acid in, and now you have a problem. And now if you feel nauseous or it burns, or worse yet, you have bacteria coming in, H. pylori, there's ulcerations, and then you take the acid, which burns the ulcer, leading to worsened ulceration. So there has to be steps and processes. We have to know what we're doing before just dropping down the acid. But if you have acid reflux once a week, it's probably safe. And apple cider vinegar has also been shown beneficial in managing or killing off H. pylori. So it can be one of those things we use short-term therapeutically.
What do you think about the H. pylori treatment?
A quick 10-day to 2-week antibiotic they'll give you. You have microbes everywhere, and antibiotics are a nuclear bomb. They'll just bomb everything.
Yeah, let's talk antibiotics.
Yeah, antibiotics, they basically work in a few different ways. Long and short, they disrupt your bacteria. So bacteria, they'll either break down the membrane, causing the bacteria to effectively die. It's like putting a bunch of holes in a human being, bleed out. Or it shuts down certain protein synthesis so that the bacteria cannot create proteins vital for survival, or it shuts down a certain nutrient they need. Some way, it basically kills these bacteria. But if you think about it, certain animals are maybe susceptible to certain toxins, right? Like my dog, I will never feed him raisins, grapes, or chocolate. Very toxic for dogs. There's a lot of foods that are common for humans, but toxic for dogs. But if you give it to a lion, they have chocolate and grapes, they're probably going to be fine. And so there are some species-specific toxins. The problem is, it's not just dachshunds like my dog. It's all dogs that are that have toxicity to chocolate and grapes. And so when you use one type of antibiotic that just destroys the mucous or just destroys the membrane rather, what ends up happening is you kill all the bacterium that respond to membrane degeneration, or all the bacterium that respond to this type of protein being shut down. So now you've killed all the dogs, not just one invasive species, for example, like a coyote, right? And so we have to look at this and say antibiotics are going to kill everything of a similar subgroup. And H. pylori, you take antibiotics that often give you for that, you're killing off everything, not just in the stomach, but in the mouth, in the digestive system, in your skin. You have microbes everywhere. And if we start killing them off with antibiotics, what are we doing? We're contributing to the problem and causing a severe deficiency. And now those opportunistic microbes will come back because your defenses, the good guys, the microbes we want in the system, are dead. There's no moat around the castle to protect you. So invaders come right in everything you eat. It's like having low stomach acid all over again. That's one defense, but bacteria are another defense. They kill off and eat and destroy and keep things at bay. Take antibiotics, you kill it all.
So the H. pylori treatment, 2-week course of antibiotics, and taking a PPI is actually really just making the problem worse in the long term. Immediate solution, but long term.
I absolutely agree. There's all kinds of things you can use naturally. Bismuth, that's a great solution that can help with H. pylori. We can use clove, oregano, thyme, even honey, lemon balm. There's all kinds of natural herbs that will not only be beneficial with anti-inflammatories or antioxidant effects for the body to benefit it, but a lot of these natural solutions we have, plant-based, can also help support the good microbes while killing the bad. So instead of killing everything and hoping they don't invade and grow back, you support the good, kill the bad, and triple down on your defenses. And there's a lot of benefits to going the natural route. Now, that being said, I want to preface, if I'm in a motorcycle accident and my arm flies off, don't give me lavender oil. Get the drugs, get the antibiotics, get the anesthesiologist. I'll figure out the recovery later. There are critical needs for antibiotics. For something benign, like an acute H. pylori infection, 100% of the time I'm going natural because it'd be so much easier and the long-term outcome is so much more beneficial. The body is not stupid. We treat it like it is.
Let's talk another case scenario besides indigestion. Constipation. It's a big one, especially for people in the food addiction world who move over to keto. What would you do? Somebody walks in with constipation and they're doing a low-carb diet and there's no more roughage anymore. So what would you do?
This is an interesting question. This is going to come from a couple different prongs. So the first one, Vera, I'm going to say I wouldn't do anything different immediately than someone who's got diarrhea. Because we have to look at constipation, diarrhea. Yes, one is a slowing down, one's a speeding up. But both of them are dysfunction, often coming from the same place. So we have people who have both constipation, diarrhea on and off. That can have to do with their nervous system, whether it's slowing up or speeding up or slowing down the motility. It can have to do with the microbes, the food, the whatever it is. So number one, I want them to learn how to relax and rest and digest, to get out of this constant fight or flight state most of us live in, to come and let things just chill a little bit. But constipation, diarrhea are both byproducts of a dysregulated nervous system, bacterial imbalances, and inflammation of some kind or deficiencies. And if we can correct all of those, no matter what you have, I treat them the same. Now, with constipation, remember we talked about drainage. If you're not getting rid of toxins like stool, you're making poop to get rid of it. But if you're not getting rid of it, you're actually reabsorbing a lot of it. You can reabsorb hormones. That beta glucuronidase we talked about will recirculate and reabsorb it. It's like reusing the same lint roller over and over till you have this bushel of fur. You want to get a fresh one, right? So you need to get rid of this stuff. And we will utilize things like high dose vitamin C, magnesium citrate, or some other magnesium that will actually help move the bowels to get rid of that toxicity. Whereas someone who is constipated, maybe we'll slow things down so they can absorb the things they're supposed to. So maybe we'll utilize slippery elm bark powder, or again, rest and digest neurological stuff, whatever we might need to slow that down, or anti-inflammatory support till we can get that down so they can absorb what they need to. But we have to consider, oftentimes the body, when we have an issue like constipation, it's typically a dysfunction causing slowing down. But diarrhea can happen for two reasons. One, it is speeding up because of a dysfunction, or two, your body's trying to get rid of something. So it deliberately creates diarrhea. And so do we want to slow down what your body's trying to get rid of so it now absorbs the thing your body's trying to get rid of intuitively? So we have to know what we're doing in balancing both of these. But we can also come at it from a microbial place. If someone comes in who switches from, let's say, the standard American diet, cheeseburgers, French fries, pizza, beer, hot dogs, whatever, it is devastation on your microbes. So a lot of us in North America lack a lot of the necessary microbes to break down fiber, say. Whereas over in Africa, with the Maasai people, or a lot of these really studied hunter-gatherer tribes, they have microbes in their gut that we do not. They can actually digest the fiber. Human beings cannot digest fiber. We don't break it down. Your microbes do. And if we don't have the microbes, like most of us in North America have really lost, we're not going to break down fiber properly, which can lead to inflammation, which can lead to constipation or some kind of irritation from the roughage not being broken down.
That would explain why some people can't eat fiber.
This is a report. I might have referenced it in our last episode. I talk about it all the time. I think it's completely underutilized for what it can tell us. It was from Cell Reports back in 2018, and it talked about the study of microbiomes from Africa, rural and urban, to America, rural and urban. And they took a look at these two sets of microbes, and they did find that in Africa, they had more fiber digesting microbes. They had more variety and diversity. Over here, we did not, which adds to my theory again, saying, why is the carnivore diet so good for people? One, they're cutting out the 20,000 pesticides they use. Number two, they're cutting out a lot of the fibers that maybe the invasive species like your fungus or your parasites or other things would be eating. Number three, they're not giving roughage to a system not designed to handle roughage, and suddenly the diseases go away.
Yeah, got it.
It makes sense to me. Yeah. That's just the running theory, but I have yet to prove it. So when we're looking at how these people transfer and have constipation, you may need some support to your body can adapt. Your microbes, let's say it's a microbial issue. We lack the microbes. Sometimes taking probiotics can help, but it's sometimes just a matter of time, right? There have been studies where they've gone over to Africa, the scientists have gone over, checked their stool beforehand, and then a week living in these hunter-gatherer tribes, and they already found beneficial changes to the microbiome. So it can happen very quickly. And sometimes you just need time to adapt. But in that adaptation time, we sometimes need to use high-dose vitamin C, magnesium citrate, something to move the bowels so we're not reabsorbing these toxins in the meantime.
Now, slightly different, people who have had bariatric surgery or who have taken medications like Ozempic. So there's been some changes that have happened, some manipulation of hormones that surely must affect the microbiome.
I have had experience with bariatric surgery. In fact, Lynn, the first story, the 57-year-old who broke her world record, she had a surgery before she came to see me the first time. And so I've seen what that does. Luckily, she was eating well enough, but depends on the surgery. A lot of the time, they'll either do a band around the stomach, they'll cut a portion of it out, they'll do something to modify, which will change the stomach and stomach acid and the digestibility, which changes the downgrade effect. Whereas like a GLP, for example, like Ozempic or Wegovy, these are peptides that modify your digestive system, your hunger signals, so to speak.
Yeah, like for example, gastroparesis, which means that the gut is slowed down. Surely that would invite opportunistic infections that are going to take advantage of that delayed transit.
Yeah, even hyperfermentation.
Yes.
So we have slowed motility. We do see a lot of overfermentation. There are different segments of your small intestine. Each segment, every 8 to 10 inches, does a different thing. This first segment might digest more of the proteins, the next the carbs, the next the fats, the next the fibers, the next one's for absorption, the next one's for fermentation. But if you're not going through these segments properly in the proper time and cadence, they sit there too long. Imagine an automated factory system where you're building a car on an assembly line and it comes down and screws these bolts into the engine. Now the engine sits there. By the time it's done, it's got 40 bolts too many screwed into it. The engine doesn't work anymore. Then it finally moves on to the next line. They're like, the hell is this? This isn't an engine. It's full of holes. And they do their best with it. By the time it comes out, it doesn't look like a car anymore, nor does it run or operate. And so when you mess with the motility in one area, you get hyperfermentation. The microbes are doing too much work on this thing, this food. It gets to the next segment and like, the hell happened to this? It doesn't look like what we're used to seeing. And now we have this downgrade effect. So there is a lot of that.
That's the same thing that happens with the surgery. There's so many bypasses where areas are being missed. Surely a similar process is happening.
Yeah, I think this is a really important point to talk about. There's obviously an obesity crisis in North America. There's no doubt about that. Yay, we've gone to self-love and all these different things, which helps us deal with the crisis, but we're not getting to the root of the problem. We're just band-aiding it again with feelings rather than actually finding solutions to why it's happening. We're talking 70% is unfit for military service, considered overweight, 40% is obese, 40% is pre-diabetic, and 15-20% diabetic. That's a major, major issue. It is a health epidemic, but we're not looking at this. Instead, we're going, obesity is genetic. No, it's not. Simply 20 years ago, obesity was half of what it is. Something is happening, and it's not genetics. They don't change that quickly. And so when we start looking at this change of human anatomy and human health, it's an epidemic level issue. And we're talking about, let's go back to peptides like GLP, Wegovy and Ozempic. They can slow down your desire for food, but the foods we're eating increase our desire for food, and they disrupt your gut microbes. And your gut microbes are responsible for blood sugar regulation, even hormones, which are connected to weight gain. They're responsible for so much more. So the food we eat can disrupt the gut microbiome, which leads to inflammation and hormonal disruption and blood sugar dysregulation, which contributes to obesity and diabetes. Then the foods we're eating actually contribute to hunger. We feel hungrier, inflammation goes up, we store more fat, we eat more food, and the cycle continues. Microbes destroyed, blood sugar elevated, inflammation up, hunger hormones up, more food in, microbes destroyed, blood sugar up, and on the cycle goes. And we wonder why I have an obesity epidemic.
And a food addiction crisis.
Huge. And so what do? Is we band-aid it with GLPs. And so instead of actually dealing with the food problem or the toxicity problem or the microbial problem, we band-aid the hunger and stop ourselves from, we just eat less of the garbage that caused the problem. But you're still eating garbage, just less of it. Doesn't make it okay, just makes it less bad. And if that's what you want for yourself, that's fine, but you're going to be battling sickness, obesity, disease, and gut issues the rest of your life. We have to change the thing we're putting in, not the amount we're putting in.
And the GLP, it's not just that it's a Band-Aid, but it contributes to the problem further.
There are legitimate medical uses for it, for blood sugar, and that's what it's originally intended for, is blood sugar regulation, but they found it had weight loss effects, and now you got a pharmaceutical golden goose. There's an obesity crisis made by food industry who then sells a solution from pharmaceutical. Love it. That's the best business model you can make. But there are legitimate uses. On the other hand, it's being abused by probably 98% of the users, and that's another issue.
I mean, we can say it's a legitimate use because we've studied it to a certain degree, but I simply cannot see how this slow transit, which I just keep thinking it's like a dark pond where there's going to be more mosquitoes. It's just inviting that kind of growth that surely over time, 3 months, 6 months, after a certain period of time, how can it be not damaging?
I'm not an expert on the topic, but I can say, like I can with anything else in the body has auto-regulatory mechanisms.
Yes.
It's balancing itself constantly. The minute you go in and start to mess with it, you've now created a problem, be it small or large.
Exactly.
Right?
Yeah.
And it will compound in some way. It's if you don't rotate the tires on your car, you need to rotate, right? That's part of it. Otherwise, you'll wear down one end more than another. Exactly. And that happens. It's a very small thing you may not notice, but months down the road, the tire starts to wobble, or the steering wheel starts to wobble. And then months later, it starts to pull hard left. And then months later, you break something. And then months later, your axle goes through the hood of the car and it rips the thing apart. Now you got to replace the whole car. If the body isn't allowed to regulate and just rotate its own tires, other things eventually happen, be it months or many years down the road. We don't really know it's happening until it's too late.
This concept of the short chain fatty acids that are beneficial to us and that are part of the good bacteria that we want to maintain. Can you tell us a little bit more about what they are and how we get them and make sure that they work for us?
Yeah, absolutely. So when we look at short chain fatty acids, we'll often hear them referred to as SCAFAs by some, but there's 4 of them. And so the 4 are going to be acetate, propionate, butyrate, and valerate. And these are our 4 main short chain fatty acids. They balance and regulate pH in the gut. They promote fat metabolism. They're used as energy sources. Propionate, for example, it's metabolized or used up by the liver, which helps regulate glucose. So blood sugar production, it supports energy. Butyrate is one of the most important for colon health. It provides energy to the cells of the colon. It supports the gut barrier integrity, anti-inflammatory properties. There's immunomodulation or regulatory benefits. And valerate, it's smaller in quantity, but it also contributes to gut health. It promotes bacterial diversity, gut barrier function. There's so many benefits to what they do for us, but they're produced by our gut bacteria. And so the minute we start messing with our gut microbiome, then we start to lose these highly beneficial fatty acids. Look, the foods we're eating, it's called the Standard American Diet, acronym SAD. Yeah. Pun is on us, the irony is on us. And so it's the foods we're eating that are destroying the microbes producing these good benefits. And if we can simply eat things that are, I look at it this way, long and short, if great-grandmother wouldn't recognize it as food, we shouldn't eat it because she didn't have 98% of the diseases 200 years ago or even 100 years ago didn't exist. Neither did 98% of the foods we have today. And so it's a direct correlation. We know the foods we're eating are causing the problem. They go, the dose makes the poison. Here's the thing. We are microdosing 100,000 different poisons, new chemicals, about 100,000 added to our world, most to our food supply in the last 100 years. We have just in the 90s, when bowel disease was half or less of half of what it was today, we had 700 pesticides for use, maybe 800. Today it's 20,000 pesticides for use. There's more toxicity, more junk than ever before. And so we want these short chain fatty acids, but we need the microbes to create them. And the microbes are an ancient bacteria that have been there since the beginning of time, and they are now being force-fed foods they've never eaten before, and we're wondering why they're not behaving.
We can get those in real food, obviously, as opposed to processed food.
Short chain fatty acids, you can take butyrate supplements and things, for example. They got to be made by your bacteria. And so if we want to have them made in our body in the numbers and amounts we're supposed to have, then we have to be taking care of our microbes, which will come down to your food. Are you eating fermented food? Are you eating whole foods? Are you eating toxic foods? Are you eating foods that never existed? Foods that only came in that the microbes have never eaten before? You're not going to get your same byproducts. You're putting things in the factory with ancient machinery and you're giving it brand new chemicals and wondering why you're not producing what you should be producing. Give it ancient food.
Do we need supplements on top of the food to support the positive bacteria?
Yeah. The body, we talked about homeostasis and autoregulation. The body will regulate itself. On the other hand, we are now at a critical point where I believe most of us do need supplementary or pharmaceutical grade help to get our body back to regulation. If it was a little bit of a change here or there, one McDonald's hamburger a year, it'll re-regulate. But we're constantly so bombarded, it's too late. We have to go back and rebuild, which means we need help. So food is the first thing. Stop making it worse. Number 2, we have to go back and rebuild those structures. We also have to remove the invaders that moved into the home in the meantime, those fungi and parasites and other things.
And so if you treat the gut, some of those symptoms, the insane cravings, the relentless appetite will actually right itself.
Yes, much of the time. It absolutely will, because that's your body re-regulating itself. Your body doesn't crave calories. Your body craves nutrients. It wants to be nourished first. The vitamins, the minerals, the fatty acids, the things that it needs to create its normal function. That's what it's going to crave. It's not going to crave the calories. The problem is we hear the word food addiction. Often there's shame associated. We go, that's not me. I'm not addicted. I can eat healthy if I want to. The foods we're being fed, they're GMOs, genetically modified to resist poison and other things, but they're also chemically engineered to be as addictive as possible. Yeah. They're designed to stimulate certain chemicals in your brain to make you want more, but to not be satiating so you're not done eating them. They're nutrient void. You have to keep eating more, and it just stimulates more hunger, and they're addictive to the brain. So in they go, and back on that cycle we go. And so we are all food addicts because the foods we are being fed from a factory are designed to make us addicted to it.
And it's not just the foods, but also the bacteria that are fed by those foods are making us further addicted.
Yeah, I mean, you have certain microbes now. The overgrowth, Candida is a great one, super common. There's 100 and some Candida species, but invasive Candida sends signals to your brain saying, give me sugar, give me carbs, give me starches, give me alcohol. Yeah. And now they're overgrown. They're sending the signal saying, I want more of those things. And now you got those cravings, that hankering. You're hangry because your blood sugar's up and down. Yeah. But a healthy, regulated body will not have any of these problems.
And how is your approach being received? You're teaching doctors out there in the community. You're working in the community. Is this something that you see more and more people are open to, or is there still a strong resistance?
I think there will always be a strong resistance. The mainstream media, there was just recently a really great event that happened with American Congress and the Senate. And it was Mark Hyman and Casey and Callie Means and the Petersons. And they went up talking about the food crisis. And there was publishings in media going, the woo-woo crowd is here and blah, blah, blah. And they're making it look like a political, crowd, everyone's nuts. Like, can we not put the pieces together? And so now we're politicizing toxic food rather than just talking about it objectively and saying, this is a problem. Look at the correlation. And so
I love that. You said we're politicizing it. That's great.
We are, and that's the biggest, isn't that the biggest problem, hey? We're making food a political agenda, but when you have billions of dollars, if not trillions, in food, in healthcare, in sickness and disease, and the CEO will move from one big food to a big ag company, to a big pharma company, to a hospital company, and you wonder why there's conflicts of interest that lead to this disease being proliferated nonstop.
Yes.
It's just part of the system that's sort of evolved over time.
You haven't said anything about your podcast, ReversABLE. Can you tell us a little bit about it?
Yeah, I'd love to. So it's called ReversABLE. That's ReversABLE, ABLE. It's ReversABLE, the ultimate gut health podcast. And it's all about how our gut and our world interact. I'm releasing an episode now. We just talked about one about how to even look at your stool, your poop. What does it tell you about you? The smell, the color, the texture, components. What does it say about your health, your heart, your liver, your hormones? We talk about sound and sound frequency. Like the very music we listen to can actually contribute to gut issues, believe it or not, because of the frequencies. We talk about stress, anxiety, moods, depression, food, the food industry, healing, farming, all these different aspects. We have just some amazing, very famous guests and doctors and specialists coming on once a week to talk about that. And I do another episode once a week as a quick tip to what our listeners write into. And so all that can be found anywhere you listen to podcasts. That's ReversABLE, the ultimate health podcast.
Thank you. And if somebody wants to seek you out, you're in Canada. Do you do virtual consultations and only in Canada or across the world? Like, how do people find you if they wanted to pursue your program?
Yeah, great question. Thank you. We are all over the world. So I am based in Canada, but we work with clients in any country. We've had clients in Thailand, Philippines, UK, Australia, New Zealand, US, Europe, Eastern Europe. We're all over the place. So you can reach everything you need to know, including the podcast, or contact for us is at gutsolution.ca. That's all singular, .ca for Canada, gutsolution.ca.
Okay, wonderful. Thank you. We'll have it in the show notes. Okay, so as a final question, is there a lasting thought or message that you'd like to leave with us?
Absolutely. My thought is this, is that the Western world treats disease like it's innate to our DNA and our biology. We're sick because we're human. We're sick because our body's making mistakes. But never in the history of ever and always has a human body been as sick as they are today. Do not accept your diagnosis as being what it is. A diagnosis, it's simply a term, a collective word that describes your symptoms, that tells you what's going on and where it's happening, but it does not tell you why. Once you get to the why, all diseases can be reversed, including Crohn's colitis. We're told it's autoimmune, genetic, and unknown cause. Yeah. None of that's true. I just released a video proving that. And so don't accept your diagnosis. Always look for the root, and your body can heal itself.
All right. Thank you so much for coming back a second time and elaborating further on treatment. Very much appreciated.
Thanks for having me, Vera.
Thanks for joining us this week on Food Junkies Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life Support Group, I'm Sweet Enough. Molly and Clarissa are food addiction professionals who offer one-to-one counseling and group coaching through Sweet Sobriety. Please subscribe to our show so you never miss an episode. While you're at it, if you found value in today's episode, we'd appreciate you leaving us a review on your favorite platform. Your feedback helps grow our show and allows us to reach others who need to hear this message of recovery. Don't forget to pick up a copy of Dr. Tarman's book, Food Junkies. And as Vera always says, the power is ours.